Hello everyone, my name is Dr. Hemant Kumar. I am a PGY2 in the emergency department. Uh, Today we are covering the 12 cranial nerves. In this video we are covering all the 12 cranial nerves, their origin, their fiber, their type, function, and the clinical parts you need to know about. Uh, you need to know about. We will do it under 5 to 6 minutes max, and you will all know all the cranial nerves. Okay. Let's start with the first six cranial nerves. Cranial nerve one is the olfactory nerve. That is the pure sensory nerves. Carry the sense of the smell from the nose to the olfactory bulbs, and the telencephalon. This is the only cranial nerve that bypass the thalamus. That is pure sensory nerve. First, you have to remember this is the pure sensory nerve, and its function is to carry the smell. Okay, that is all you need to know about, and the origin and the insertion I will let you know about all the date in the other slide. Okay, the second cranial nerve is the optic nerve. Optic nerve it's also a pure sensory nerve. It's for vision, technically an extension of the brain, not a true peripheral nerve. This is the extension of the brain, that is not the true peripheral nerve. Its function is to carry the vision. Cranial nerve 3 is the oculomotor nerve, that is the pure motor nerve, control most eye movement up, down, and medially, plus pupil constriction and eyelid elevation. It also carries parasympathetic to the ciliary ganglion. Fourth is the trochlear nerve. Trochlear nerve motor only move the eye downward and the inward. We have the superior oblique muscle. Key factor is the only cranial nerve that exists from the dorsal brain stem. This fifth is the trigeminal nerve. This is the mixed nerve, both sensory and the motor. It has the three branches. V1 is the ophthalmic division, V2 is the maxillary division, and V3 is the mandibular division. Sensory for the face, and the V3 also control the muscle of the mastication. Cranial nerve 6 is the abducent nerve. Motor nerve control the lateral rectus, move the eye outward and abducts it. Now the nerve is from 7th to 12th. Seventh nerve is the facial nerve. It is a mixed nerve, control all the muscles of the facial expression, not the sensation. It also carries taste from the anterior two-third of the tongue and drives lacrimal and the salivary gland. The lacrimal and salivary are driven by the facial nerves. Cranial nerve 8, it is the vestibulocochlear nerve. That is the pure sensory nerve. This cochlear branch handle hearing, the vestibular branch handle balance. Damage is equal to tinnitus, hearing loss, and the vertigo. Cranial nerve 9 is the glossopharyngeal nerve. Mixed carries taste and the sensation from the posterior third of the tongue. Drive the parotid gland and the monitor the carotid and the sinuses. 10th is the vagus nerve, the wandering nerve, mixed nerve. Carries parasympathetic to almost all the thoracic and the abdominal organ, controlling swallowing, voice, gut motility, the list goes on. Cranial nerve 9 is the accessory nerve. Pure motor nerve control the sternocleidomastoid muscle and trapezius muscle, so head turning and the shoulder shrugging. Cranial nerve is 12 is the hypoglossal nerve, that is the pure motor nerve, control tongue movement, crucial in for speaking and the swallowing. Now the fiber types and the functional components. Number one is the sensory only. The fibers that are only sensory is cranial nerve 1, cranial nerve 2, and the cranial nerve 8. Smell, vision, and hearing and the balance. That is the only sensory. Now the fiber that are the motor only. Motor only are cranial nerve 3, cranial nerve 4, cranial nerve 6, cranial nerve 9, and cranial nerve 12. Eye movements, tongue and shoulder muscles. The fiber that are the mixed, both that are sensory and the motor. That is cranial nerve 5, cranial nerve 7, cranial nerve 9, and the cranial nerve 10, the biggest and the most complex nerve. And the four nerve carries uh, parasympathetic fibers, which are cranial nerve 3, cranial nerve 7, cranial nerve 9, and cranial nerve 10. Origin and exist point from the skull. Cranial nerve 1 and cranial nerve 2 originate from the brainstem, telencephalon, and the diencephalon. Cranial nerve 3 and cranial nerve 4 come from the midbrain. Cranial nerve 4 is unique as the only one existing dorsally. Cranial nerve 5, cranial nerve 6 come from the pons. Cranial nerve 7, cranial nerve 8 come from the pons medulla junction, and the cranial nerve 9, 10, 11, 12 come from the medulla. For existing node, cranial nerve 3, cranial nerve 4, and cranial nerve 6 all leave through the superior orbital fissure. Cranial nerve 5 is split, V1 through the superior orbital fissure, V2 through the foramen rotundum, and V3 is the foramen oval. Cranial nerve 9 and cranial nerve 10 and cranial nerve 11 all share the jugular foramen. Now the key cranial nerves reflex that you should must know. There are the four that you must know. One is the pupillary right reflex, shine a light. Both the pupil constrict. Afferent is cranial nerve 2 and efferent is cranial nerve 3. Corneal reflex, touch the cornea. You blink. Afferent is V1. Afferent V1. Efferent is V7. V1 is the fifth cranial nerve, first division of the fifth cranial nerve, that is the ophthalmic division, and the cranial nerve 7 is the efferent, lost in fifth nerve palsy. Gag reflex, touch the pharynx, patient gag. Efferent is 9 and afferent is 9, sorry, efferent is 7. Efferent is 10. Test bulbar function. Jaw jerk. Tap the chin. Jaw closes. Both afferent and efferent are V3. A brisk jaw jerk mean an upper motor neuron lesion above the pons. High yield clinical pulse. Cranial nerve 7 Bell's palsy, that is caused by the cranial nerve 7, the lower motor neuron lesion. Whole face is affected, including the forehead, upper motor neuron lesion. Spare the forehead. Horner syndrome, ptosis, meiosis, and hydrosis. This is the sympathetic chain lesion, not cranial nerve 3. Not cranial nerve 3. Cranial nerve 3 palsy give a big dilated pupil. Cranial nerve 3 palsy, down and out eye with a dilated pupil. Posterior when did it happen? Most commonly it happened in the posterior communicated artery aneurysm until proven otherwise. This is the neurosurgical emergency. Cranial nerve 6 palsy, most common false localizing sign, raised intracranial pressure, stretch cranial nerve 6, diplopia on the lateral gaze. Tongue deviation. Tongue deviation toward the side of the cranial nerve 12, lesion with wasting and fasciculation ipsilaterally. Vagal lesion, hoarseness, dysphagia, uvula deviate away from the lesion site. So there was the mnemonic written on the first slide. That is the on old Olympus towering tops Finn and the German viewed some hopes. That is on is for olfactory nerve, Olympus is for optic nerve, or oculomotor nerve, old is for optic nerve, towering is for trochlear nerve, trigeminal tops is for trigeminal nerve, abducent is A, fins for facial nerve, end is for vestibulocochlear nerve, German is for esophageal nerve, viewed is for vagus nerve, sum is for extrary nerve, hope is for hypoglossal nerve. So that is all the 12 cranial nerve. If this helped you, smash the like button, subscribe and share. Thank you. See you in the other video. Thank you.